Agenda, we're going to go over some team updates. We'll talk about a few new features that are available on your admin portal, and then we have some general updates, some around coverage changes, the PO monthly calls moving forward, VBR deadlines, cohort 2 onboarding, data and patient dashboard updates, and specialist recruitment. So, as everyone's been notified in the Learning Community newsletter and otherwise, Dr. Carolyn Richardson, who is the program director of MCT2D, has taken a new position as the chair of family medicine at Brown. So, in her place, we are having Dr. Lauren Oshman serving as the new program director for MCT2D. You'll have seen Dr. Oshman present at the spring regional meetings and at the collaborative live meetings. She was previously a co-director in the program and now is a full director. And we also have Heidi Diaz, who is our pharmacist. She's our pharmacy lead on the project before taking this role. So she worked with Dr. Oshman on the medications training. She leads the quarterly pharmacist work groups and the pharmacist drop-in sessions, and now is a co-director for the program. Additionally, we don't have a slide regarding this, but Jake Reese, who was previously our quality improvement specialist, is now the associate program manager for MCT2D, and he's going to take over leading one of these PO monthly calls each month. So depending on which one you join, it'll be either me leading or Jake leading those calls. So just wanted to make you aware of those changes to the personnel in the coordinating center and who is in new positions. So to go into some new features on the administrative portal, we've added a few things based on requests from you and just based on the general updates that we need to make as we move into the second year of the program. So we're going to talk about downloading data, reporting issues, and the cohort 2 VBR tables. So one feature that multiple physician organization leads have asked us about was the ability to export and email the VBR metrics table. So now when you click on the VBR metrics tab of your administrative portal, you'll see an option that I've highlighted on this screenshot that just says click here to have the table data below emailed to you. So when you click that button, whoever's signed in, so you may have multiple portal users at your site. When you're signed in, it's going to send it to you. When they're signed in, it'll send them a copy. It will send you a CSV file that you can just click and it opens it in Excel, and you can filter the data, sort the data, etc., share that more widely within your organization. So hopefully that meets all of your needs around being able to access this data outside of the administrative portal. We also on the VBR metrics page have a new option to report any errors in the data. So on each individual physician's line in the VBR metrics tab, if any of the information is correct, you can send an email right from the website as opposed to opening up a new email. It'll automatically address it to me and it'll title it MCT2D VBR metrics issue. This shows up after the final column, after the all VBR requirements complete, as kind of a final like administrative column. So for example, maybe you have a physician who took the training, but it's saying that they had it on here. You can click that button. The quickest way to do this would be to attach the confirmation that they'd completed the training, for example, because most likely they didn't check the box that allowed their data to be shared with us. That tends to be the most common issue we run into with the trainings, and then we would correct that for you. So hopefully that just streamlines a little bit that process for you of letting us know of any errors that we need to correct there. And then finally, the cohort 2, if you recruited new sites in 2022, their VBR tables are now available on the VBR metrics tab. First, you'll have the cohort 1, year 1 table. So that's the one you're most familiar with looking at and that I've been working with all this year. And right after that, you'll see the cohort 2 tables if you'd enrolled new sites. And then as of Monday, 10/3, we're going to have the year 2 variables for our currently participating sites, and we're going to archive the table that's currently there. So as you all know, September 30th is the deadline for all the requirements to be met. So that's primarily pertaining to the physician level, practice level, and PO level learning community requirements. If those haven't been met, in the final case summary being submitted after September 30th, like I said, they'll all be moved to that archive tab, and only the current VBR will be in VBR metrics. And as a reminder of like that cohort 2 tables that you're seeing and where we are with that. So As far as things that have already completed, this clinical champions and practice liaisons for all of the cohort 2 sites have been submitted. They were due in mid-August. The things that are currently in progress are attending and completing the MCT2D training sessions. So we are having the cohort 2 complete those like on their own time on the virtual sessions. We're asking those be completed by the end of December. And the practice change readiness assessments are due at the end of this week. We've followed up with any that still need to be submitted. It's similar to what we had last year for the cohort 1 sites, but we made a few tweaks based on just like lessons learned from what was useful information where we felt like there were gaps. So we're asking that the cohort 2 complete those as well. You'll see on here the spring regional meeting. Just as a reminder, we're not having the cohort 2 attend the fall regional meetings. We're going to have them start in the spring once they've completed their training and kind of following that same timeline as the cohort 1 sites did, where they spend the fall of like this first year getting ramped up, doing the training, doing the practice change readiness assessment, and really diving into like implementing the quality initiatives in the next like calendar year. So that kind of coincides with attending those meetings for the first time in the spring. We've tentatively sorted the new cohorts into their regions, and we'll be sharing that information with you soon for your feedback, so you can change it if something is a better fit just for how your PO operates and the relationships that exist between your practices. So we'll have that information to you in the next month or so to get your input on that. And then most of these things are things that you've seen before, and I won't specifically go into details on around just responding to requests, presenting on implementation if asked, distributing pros, and just will call out these 2 things that have changed. So the case summaries is one component we changed for cohort 2. As a reminder, instead of per physician, we changed them to 3 per practice and 1 on each initiative. So the feedback we got from you last year was that these physician level requirements were a bit challenging. So we thought we could remove that case summary burden, at least by having that at the practice level. And then the only physician level requirement will be the learning community BBR that's at the physician level, which is fairly achievable in my opinion, as far as just submitting feedback on a tool or attending one of the webinars, especially now that we're offering those recorded versions of them. And then finally, the only other new component for this next year's of BBR is the coverage for your primary payer. So this isn't available yet. Just wanted to call out that's something new that we're adding for this year. What we will likely do in the format this will take is just a really deep dive into an individual payers like coverage around the medications, around the CGM, including prior authorization criteria and like the preferred medications, likely be like a YouTube video. And then at the end, we would ask them some questions. They would self-select what their primary payer is and like complete the requisite like learning related to that. So just considering that the biggest challenge that we still hear from everyone is around understanding what should be prescribed, what's going to be covered, what's not, we thought that having this as a requirement might help. And that's at a practice level too. So likely the clinical champion or someone be doing that for the practice. And we'll let you know when that's available. Any of these that don't have a specific due date are just due July 15th of the 2023. So we'll have that out with plenty of time for them to complete that and review it. Okay. So fall regional meetings are beginning in less than 2 weeks now. We have registration information that we sent you via email. It's also available at this link, and we'll post the slides after this so you can easily access them. First meeting is October 10th, and they go through November 2nd. We will show you how to track the registration on each of your sites. So on your administrative portal along the left-hand side, there's a tab that's called registrations. When you click that, until you click one of these buttons that are available, either collaborative wide registration or regional meeting registration, it's going to be blank. It's not going to auto select one of those for you. So it will look like no one's registered, but it's just because you have to filter down into who has. So when you click regional, it'll show you the clinical champions that have registered for each of your participating sites. So be checking in on that and making sure that people are registered. This is a BBR requirement to attend these meetings. We've followed up with the practice clinical champions who haven't registered for the ones in October 10th and October 12th, since we're vital head counts to those are due. That said, if your clinical champions haven't registered yet, even for those upcoming ones, just reach out to us at the coordinating center and we'll make sure that they get registered for those and are still able to attend. As a reminder, the fall regional meeting agenda is here. We incorporate some feedback based on what we heard from you at the spring meeting. So building in more time for questions. So for example, like while we have this welcome and updates scheduled for 15 minutes, we plan to talk for 10 and like leave a good amount of time to have questions. We've invited the patient advisors that are on our advisory board to attend these meetings as per the request of attendees last time. So hopefully a couple of the patient advisors are able to join us like they did at the collaborative wide meeting. We're going to have members email questions before the meeting. So a week out, we're going to be sending the meeting packet info to all attendees, and we'll make sure to solicit any questions that they'd like addressed during that meeting at that time too. And at the same time, send out discussion topics like for this breakout session too. So trying to incorporate what we learned from your attendees at the spring ones to make these run even more smoothly in the fall. So for the agenda, we're going to just open with welcome and updates and things that are going on in the program. Jake is going to give an in-depth demonstration of the new dashboard features similar to what he did at the spring one. So we have the summary statistics that have launched in that meantime, and we'll be showing you how that works, how to filter that, what kind of things we can look at there. Following right after that, we're hoping to talk a little bit about the regional summary statistics and performance. So we'll outline some questions that can be discussed during that time. We'll share them before. We've incorporated a short break into these meetings. Then we're going to have endocrinologists from each region present. I have a few more details on that in the next slide. Our dietitian, Rena, is going to be giving an overview on operationalizing a low-carb diet in type 2 diabetes. And at this meeting, we'll have a ton of low-carb diet tools that we've created as part of like the Jumpstart program that we introduced at the collaborative-wide meeting. So we've really ramped up the things that we're offering around low-carb diet, including responding to the multiple requests that we've gotten from you guys on these specific meal plans. So we'll have those available. We'll discuss those during the meeting. And then we're just going to have like a wrap-up and closing section. So for the presenting endocrinologists, we've asked them to speak to care coordination and what that looks like between endocrinologists and PCPs in regard to the topic of their choosing. So if they're talking about CGM, maybe what that coordination looks like, if they're talking about the medications, how they plan to coordinate. We have an endocrinologist that is a participating site in each region presenting at each region. Those without endocrinologists, like the Sleeping Bear Dunes region or the Bluegill region, we've asked one of our content expert endocrinologists to do that. So they'll be speaking too. So even those without endocrinologist speaking will still have that representation from endocrinology there. These were some topics we gave them to kind of choose between and determine like what they may want to talk about and what might be helpful for them to present on as endocrinologists to the PCPs. So like I mentioned, we've asked all to speak to care coordination, but we've given these other options around like using CGM data to adjust medications, workflows around CGMs, using the SGLTs, GLP-1s around the specific disease states like CKD or ASDVD in addition to type 2 diabetes, insulin initiation and titration, etc. What we'll do also after these meetings, since each endocrinology presentation is going to be individual based on just what the endocrinologist from that region wants to present on. We'll collate all of these presentations into like a playlist on YouTube as well so that you can get insight from all of these other endocrinologists, and we'll be recording these sessions so that we can share it more broadly with the collaborative. Now just to go to some kind of brief updates and reminders and things that I highlighted in the beginning: coverage, monthly calls, VBR, cohort 2, dashboard updates, and specialist recruitment. So we had communicated about these in the Learning Community newsletter, but just wanted to bring them to your attention again. So we've been able to make some strides with coverage changes for the CGMs through MCT2D. So Blue Cross Complete, which is Blue Cross's Medicaid plan, spoke with us and asked for our input on their CGM policy. And so they went from this criteria on the left, which was much more extensive, where they had to have treatment with insulin, multiple daily doses 3 times or more, and inadequate glycemic control, and they're resistant to take their blood glucose, they're taking more medications, etc., to now this more expansive criteria where insulin isn't required. That's one criteria, but if they're not on insulin, but they have frequent hypoglycemia or are gaining weight or have an HbA1c over 7 or are starting a low carb diet, new medication changes, any of those are going to count towards meeting this criteria too. It's our opinion that pretty much all patients with type 2 diabetes that should be on a CGM would meet like one of these criteria, and it's pretty broad and expansive. Excuse me. Sorry, getting over a bit of a cold. Um, so we were really able to expand like what we were able to do here as far as removing that insulin requirement. So it should be really exciting, especially since, as you know, Medicaid coverage has been a bit more challenging to kind of break into and change. So this is an exciting change. Next, we have our change with United Healthcare. So there's even more kind of expansive as far as what they're allowing, where they're only requiring well, previously they required insulin, blood glucose testing, frequent adjustments to the treatment regimen, but they put in a process where if the physician is participating in MCT2D, they just have to have a type 2 diabetes diagnosis and be part of our program. So this is great news. Many of you had asked following this announcement if NPs and PAs could be included as part of this prior authorization removal. And United Healthcare was amenable to that. So later today, I'm actually going to be sending a template to each PO that just has a column for like first name, last name, NPI, practice, and if they're a PA or an NP, that will ask you to return to us by November 1st so that United Healthcare can incorporate this prior authorization removal for the NPs and PAs beginning 1/1/2023. So really exciting news there. And hopefully we can use this success that we've had with United Healthcare and with Blue Cross Complete to kind of move the needle with other insurers in Michigan as well, but are excited to be able to make these changes for patients. So for the PO calls moving forward, the October one, we're going to be canceling these due to the regional meetings. We'll share any updates that are important for you there. And then from November onwards, so most of these calls, we end up taking about 30 minutes of the half hour that we are 30 minutes of the hour that we have scheduled for these to provide our updates. We often end them early. And it just made sense that with the physician organizations that elected to join Inhale, where there's a large overlap. So I think 15 POs are participating in Inhale and 13 of them overlap with MCT2D. What we're going to do is take this hour time slot that we already have booked up on your calendars, and have the first half hour of these calls be MCT2D updates and the second half be Inhale updates. So Courtney Oliver, the Inhale PM, will be on these calls moving forward. And then if you're one of the POs that's only participating in MCT2D, you'll just be done after the first 30 minutes and can drop off. And any POs that are participating in both programs just remain on the call for that full hour and are able to get the updates for either. So hopefully that makes things a little bit administratively easier on those POs that are in both, where they only have this one call, and we've been able to condense down the time and not add more meetings to your calendar. Just as a reminder, all of the cohort 1 BBR requirements are due on 9/30. We've been sending you update emails related to that. So we sent them 2 weeks before the deadline, 1 week from the deadline. We're going to send you one tomorrow morning just with any remaining case summaries or learning community BBRs that need to be complete prior to the end of the day Friday. And then, like I mentioned earlier in the meeting, we're going to pivot this BBR table that you've currently been viewing and looking at this past year to that kind of archived folder, and then bring that you'll still be able to view. And then we'll kind of switch to having the year 2 requirements for cohort 1 visible on your active like BBR metrics page. And for any of your physicians that still need to complete the physician level learning community BBR, we now are having recorded learning community events count towards that, as long as they answer a few questions about the event. So for the following 4 presentations, the prior authorization panel, the Medicaid weight loss drug coverage, Dr. Ludwig's presentation on low carb diet at the collaborative wide meeting, and our CGM panel, if we have them posted on YouTube, they're linked here. They're linked in the email that we sent out about it. Your physicians can watch these at any time and then just answer those short survey questions at the end to kind of prove essentially that they watched it, since we don't have a mechanism to track that by, and they'll be able to get credit for that too. And we plan to keep this going forward. We understand that even though we try to schedule these at the time that's the most convenient for everyone, there's still going to be people who can't make it, who have things scheduled, and we wanted to still give them the opportunity to have this count towards that. So hopefully that makes things a little bit easier going forward for this year too as well. And we'll almost have this ready to share with all of you. We're asked our design team to just do a little bit of work on this document that's displayed on this screen, so it's a little more visually appealing than the table I made in Word. But we wanted to clearly outline for you like the cohort 1 and cohort 2 timelines, since most POs have enrolled additional sites for this year too, and you're maybe feeling a little bit like you're juggling these two different things where all the deliverables and deadlines are different amongst the two groups. So hopefully this gives you an easy kind of like one pager view of what the practices in each cohort should be working on. So we should have this ready to like fully distribute to you in a week or so. And in the meantime, of course, feel free to like look at these slides. These are primarily like the VBR due dates and what we'd look at for there, but also include things like the tentative when the regional meetings will be, when things are due, what you can expect from us. So hopefully this helps you to manage the expectations of like what each of your practices are doing moving forward across these two cohorts. And then, like we mentioned earlier with the cohort 2, with these new practices, we're working on getting them onboarded, following that same schedule that we did last year with cohort 1. So the training is taking place. We sent the information to the new practices on the beginning of September, so they've had those available to work on. And the practice change readiness assessments are due on October 1st, like I mentioned. So we sent those to the sites also in early September. They've been working on those as well. For the endocrinology and nephrology, just to give an update on where we are with those specialty types in the program. So we had, for endocrinologists, we hosted a meeting on August 3rd in the evening where we brought together all the endocrinology clinical champions and looked at some initial data for the collaborative around prescribing and CGMs. What we'll be doing next is the care coordination focused case summary. We're asking for one of those submitted per VBR earning endocrinologist in the practice. So I sent that out to everyone earlier this week. For nephrology, we plan to have a meeting similar to the one we hosted in August for the endocrinologist. We'll likely have that late fall or early winter, maybe January or so, with the same thing, an hour-long virtual meeting with the nephrologist clinical champions, where they're kind of taking a look at that initial data, they're prescribing SGLT2s and GLP-1s. And we also sent out, at the same time we sent out the endocrinologist care coordination summary, a case summary focused on the SGLT2s and GLP-1s that, again, we're asking for one per VBR earning nephrologist in the practice. Next, switching gears a little bit to the dashboard release schedule. So we just yesterday had a data enhancement release. So this brought the data current through June 30th of this year. And the enhancement component of that is all the summary statistics that we've included in this most current version. And if you've logged in since that email from MDC and don't feel confident about how to navigate it or what you're doing, or what that looks like, that's kind of what I mentioned. We'll have Jake review these new features extensively at the regional meetings and walk you through how to use them. And some different like functionalities and ideas for how to make these like the most useful for you. We're also focusing on integrating feedback from members on the user experience of the dashboard. So in August, we met with a lot of the clinical champions who have been using the dashboard to get their input on what is easy to understand on there, what's not. We pulled together a lot of design changes that will hopefully just make it easier to use in the future and a little more user friendly. So those are kind of some of the next updates that you can expect to see in the dashboards. And I just wanted to remind everyone of the data participation requirements for MCT2D. So in the participation agreement that you all signed to join the program, these were the 3 components that we had related to data and MCT2D. So it was sharing required data elements for participation in MCT2D with MyHIN and with other participants in the care and care improvement processes in accordance with HIPAA. We also have meet the public expectations of MCT2D for data collection, conformance with data definitions, timeliness, and accuracy, and establish a working partnership with MCT2D and CQI operations to develop and improve the process for data sharing. And the reason I'm bringing this up is because we're kind of moving now to a place where us as MCTGD have access to the raw data, and we're going to begin looking at each PO's data submissions and identifying where there are gaps or issues. So maybe HbA1c is only reported for 20% of your patients. Okay, why? What's contributing to that? What does that look like? Or values reported incorrectly. So for example, maybe instead of like the actual EGFR, it's like the staging that's been put there. So it's a 4 instead of like their EGFR. So there's been issues like that that have come up in the past that we're trying to analyze and understand better. So as part of this, you may be hearing from us. We may reach out to you to discuss your data submission and ways that we can improve this, because we want to have a robust, accurate data set that we're, especially as we go into setting a performance measure for the collaborative. As an example, one of the requests that we'll be making and have notified you about is around submitting like the weight unit field in the PPQC data. So that's an issue we've ran into where some are submitting in pounds, some are submitting in kilograms. Somehow some EMRs are submitting in ounces. So there's no like one-to-one comparison right now. And it's not always as straightforward as it may seem to assign the weight unit to those. So submitting that along with the PPQC will help a lot as well. There's also serum creatinine lab values that are now able to submit to that. We're going to be reaching out to each PO right now to understand your current submission status of those. So I would just anticipate, like, as we dive into this data and can look more at what's being submitted, that we'll want to partner with you to improve this where we can and where there's possibilities to do so. And finally, specialist recruitment. Just wanted to let you know we're going to be opening that up. We have October 1st. I would expect it on Monday, October 3rd, since it's a Saturday. But it'll be exactly like what you did with the primary care practice recruitment. We're going to have another tab on the administrative portal that lists out all the endocrinology and nephrology practices that are associated with your physician organization. And if any of those are interested in participating, you'll be able to click a button that says Mark is participating. And then we will circle back with you on the clinical champions for those. As a reminder, while we've had multiple different care members or care team members serve as clinical champions for the PCP practices, for the nephrology and endocrinology one, we do want those to be physicians. And we will have VBR start for these physicians on the standard specialist VBR cycle of March 1st, 2023. And that's all we had to cover today. As I mentioned earlier, the October monthly calls are going to be canceled due to the regional meetings. We'll provide updates there, but Wednesday, November 9th, and then Monday, November 14th, we will be hosting the first calls that we share with Inhale. And like I mentioned, I'll be leading one of these, Jake will be leading the other, and Courtney from Inhale will be on both of them. And we'll just remind everyone, like, if you're in Inhale, stay on. If you're an MCTG only, drop off, and we'll kind of have that 30-minute time split between the two. So that is all we had for you today. Does anyone have any questions? All right, well, we will go ahead and wrap up then. Thank you all for joining. Looking forward to seeing you at the regional meetings in the next month and a half. Have a great rest of your day.